Today I'm going to show you how to change the dressing on an Eloesser Flap wound. Now, Jim has had this since his surgery in October of 2016, so about a year. And I've been changing it myself at home since he came home from the hospital in November of 2016. I've learned a lot along the way about how to do it, but I'm going to put this out here so that, well, partly so that my daughters will have this to go by in case I ever have to be away, because nobody else knows how to do it. And partly so that you, if you have a similar wound to care for, so you'll know how to do it at home. It's a DIY. Okay, I've washed my hands, and now I'm removing the bandage. Doesn't look like there was really too much drainage. Sometimes it looks a little bloody. It did come all the way through this today, but it did not leak. Sometimes it leaks. Now, I'm going to remove the gauze packing. When he first came home from the hospital, this wound was actually about, I'd say 6 or 7 inches this way, and about 2.5 inches deep. Now you can see how much it's closed. So it really just takes that's actually 2 4x4 gauze pads unfolded. When he first came home, it took about a half of one of these rolls of gauze. This is just about a fourth that's left here. So you can see that there's been quite a bit of healing. Now, if you want to look, you can look down into the wound to see this. This goes all the way to his lung from his back. He had an empyema that formed in there, which is really just a pocket of pus that's enclosed, and that came out through his back. So they had to aspirate it first and then do this surgery, which is really kind of an archaic process that they used back in the 50s before there were antibiotics that took care of these deep infections. The infection, although I'm a cancer caregiver and Jim is a cancer patient with stage 4 lung cancer, this is actually a side effect of the cancer. The lung, from all of the treatment that he's had and the surgeries and the radiation, because he's had 8 recurrences, the lung is so damaged that it made a collecting place for the bacteria in there. So when he got an infection, which he did last year, there was no way that they could get rid of it. This was the only thing that worked. He was hospitalized 3 times last year before they decided to do this procedure. Okay, now the first thing we're going to do is I take some non-sterile gauze and I spray it with Antisept. That's a brand name, Antisept. And wipe this off. Now sometimes this is actually draining. Today it's not draining very much. Jim, will you blow out? If you can hear that, that's the air coming out there. And on days when there's a lot of fluid, it runs down this little trough and runs out. But today there's not much of that. Sometimes I have to actually put gauze in there and soak it up before I pack it. Okay, then I'll take sterile gauze pads, 4x4. And again, I'll spray this with Antisept. Now, a lot of this has been trial and error to find the best way to do this. I use a sterile long Q-tip that we get from medical supply, actually from Medicare. And this is the best way to do this. I unfold that a little bit. I put some in there. I poke it down deep into the opening, which is probably about 2 inches down there to the actual hole that goes through to the lung. And I'm going to pack that in there pretty tight, but leave a little space because I'm going to put another gauze pad. What I found, took me months to figure this out, but if I fill this trough with gauze, that keeps it from leaking out under the bandage. So I take that's one gauze pad. Now I'm going to take the second gauze pad. They come 2 in a package. Spray it with the antiseptic, although it is sterile, but I like to do that anyway. And do the same thing and finish packing that hole. You can see how far I'm going down. It actually goes down about to here. So I'd still say it's as deep as it ever was. This, by the way, does not cause him any pain, which is a blessing. It would really be hard to do if it did cause him pain. All right, so I've got that packed in there pretty well. Now this procedure takes we do it once every 24 hours. Sometimes